Let's move to the section 3 of our lecture, pancreatic cancer. And in this section, we will talk about the diagnostic imaging techniques done for the pancreatic cancer, the tissue diagnosis and cytology. Cytology is the study of the cells, which tells us what stage is the cancer. So that, and also the staging of the pancreatic cancer. So the diagnostic imaging, the techniques used for the diagnosis of the pancreatic cancer include the confirmation of inflammatory or malignant nature. It's very important, as I mentioned in the previous section also, it's important to differentiate whether it's due to any inflammation, it's due to chronic pancreatitis, it's due to hepatitis or cholecystitis. All these conditions, 3 conditions, can present with these similar signs and symptoms that can be confused with the pancreatic cancer or pancreatic involvement. So early diagnosis or early imaging done to differentiate between inflammation or malignancy is very, very important for the treatment of the cancer, because as I mentioned, it's very rapidly growing, rapidly metastasizing cancer, and it can be really fatal very fast. So early diagnosis, confirmation of inflammatory or malignant nature is important. Next, contrast enhanced spinal CT scan and MRI, that's important. So enhanced spiral CT scan and MRI is done for the early diagnosis, and that's an imaging technique that should be done, especially if it's malignancy. These 2 imaging techniques will help us to diagnose the malignant tumor or the growth. So contrast enhanced spiral CT scan and MRI. Then endoscopic retrograde cholangiopancreatography. Again, this is the retrograde cholangiopancreatography, in which the biliary tree, gallbladder, and the pancreas are studied to look for the obstruction or the growth, or the reason for these signs and symptoms which are present. Then endoscopic ultrasound. Endoscopic ultrasound is also helpful in the diagnosis. Ultrasound of the abdomen endoscopically can help us to look for the mass or the growth or the tumor. So endoscopic ultrasound. Fluorodeoxyglucose positron emission tomography, FDG-PET, that's also helpful in the diagnosis of the pancreatic cancer. And then we can do radical chemoradiotherapy. Radical chemoradiotherapy can also be used for the diagnosis. So these are all the diagnostic steps for the differentiating between the inflammatory condition and malignancy, and early diagnosis of these conditions is very helpful for the treatment options and methods that can be tried. Tissue diagnosis and cytology. Cyto is the cells, it's the study of the cell, and study of the tissues, that's histology. So what it helps, endoscopic ultrasound guided fine needle aspiration. So this is the ultrasound probe, this is the needle aspiration of the tumor. So it's the endoscopic ultrasound guided fine needle aspiration of the tumor is done, and then that aspirated fluid or tissues or cells are tested, and then it's used for the diagnosis of malignancy. Intraperitoneal dissemination, percutaneous biopsy, endoscopic retrograde cholangiopancreatography, sensitivity range from 35 to 70%. So different tests are done for getting the tissue and the cells for the examination to rule out the malignancy, or if it's already spread in the abdomen, which is intraperitoneal dissemination. Again, this is the diagram that gives the gallbladder, then we have biliary tree, pancreas, and this is the C-shaped structure, which is the duodenum. Serum markers for the diagnosis of the pancreatic cancer. We already mentioned tumor markers, serum markers for the diagnosis. We have CA19-9, which is elevated in this in 70 to 80% of the patient. This CA, which is the carbohydrate antigen 919, is elevated in patients who have pancreatic cancer, and then it correlates with tumor stage. Again, if it's too high, it means the tumor stage is already advanced, and if it's not that high, it's in the early stage. So the staging of the tumor, again, is tumor marker assessment is very helpful in staging the pancreatic cancer. Indicator of asymptomatic recurrence also. So if it's high and the patient is asymptomatic, this is also an indication that patient has pancreatic cancer, but it was asymptomatic and there were no symptoms or clinical features present. Staging of the pancreatic cancer. Here, if you see, this is the metastasis of the liver, pancreatic cancer to the liver. These are the liver metastases. Then we have the pancreas tumor, liver metastasis. This is the small intestine, C-shaped duodenum. Staging is again based on, as with any other cancer, the main staging is done by the TNM method, which is tumor, node, and metastasis. Takes into account location and size of the tumor, involvement of the lymph node, and distant metastasis. So it's very important that you should know T and M is the most important factor for the staging, and that's the size and location of the tumor, involvement of the lymph node, and the distant metastasis associated with the cancer. So the staging, as with any cancer, staging is important, and the main staging method in this case is also the TNM method of staging, which is T1, T2, T3, T4, and then the M1, in which there is distant metastasis. And then T1NO is a tumor which is limited to pancreas, and then it is less than 2 centimeters. So T1 stage, usually the tumor sizes are labeled as less than 2 centimeters, but as the tumor size increases, the staging progress accordingly. So in T2, then we have more than 2 centimeters, but again it's still limited to the pancreas, and there is no spread to the surrounding area, or there is no distant metastasis. So prognosis at this stage is little better as compared to T3 or T4, and the survival, 5-year survival, is also better, but it's not as with any other cancer that can be diagnosed at the early stage. So the survival is 20%, and in this case, the stage of presentation is about, we know in 7% of the cases there is stage of presentation. Then in the next also there is survival rate of 8%, and the stage of presentation is 26, because now the tumor in T3 stage, it spread beyond the pancreas, and there is regional lymph node metastasis also. T4, any nodal involvement can occur in this. It's not just the one lymph node involved site. And then M1, distant metastasis is present. It's already metastasized. The 5-year survival is only 2%, and the stage of presentation is 53% is stage of presentation present. So that's the staging of the pancreatic cancer, and which can be according to AJCC, American System, and TNM classification, according to the in which we find the tumor node and metastasis, and we know how well will be the prognosis and how well it can be treated, or how poor will be the prognosis of the patient. So that was all about section 3. Thank you for watching sqadia.com.